Well, it is 3:00, and 3:00, as you know, on I Heard a Ruma, is special guest time. And I am really, really excited to introduce my special guest today, who is Dr. Ali. Welcome, Dr. Ali.
Hello, Ruma. Thank you very much. I'm very thankful to be here with you guys.
Oh, well, it's lovely to have you on here. Now, Dr. Ali is an acupuncturist. And what he's going to do is he's going to tell us a little bit about himself, and then he's going to talk about acupuncture. Now, for most of us out there, and I know myself included, I think of acupuncture as just sticking needles in myself or someone sticking them into me. Now, I know, and I'm sure all of you out there know, that there is so much more to it. So, first of all, Dr. Ali, can you tell us a little bit about yourself and about your training, how you became an acupuncturist?
Sure. So, my family has been doing acupuncture and Chinese medicine for 3 generations.
Okay.
I am the 3rd generation. For me, it all started when I was in New York. I was studying in New York, and then started to work in a rehabilitation center. Then I discovered that all of this was real, and then I went back to China and studied properly, and then came back to Spain, which is the country I was born in, and then started to practice acupuncture in Madrid. Then I went to another place called Castilla-La Mancha. I'm sorry.
Yes,
sorry.
I know, yes.
And then I came here to Puerto Mazarrón to establish my own clinic doing acupuncture and Chinese medicine.
Fantastic. Now, did you study acupuncture in China?
Yes.
Okay, so how long did it take you to study?
Well, it took me 8 years.
Wow.
Okay. So in China, acupuncture is a branch extending from the normal medicine. So I have to do first general medicine, and then go into 3 years of acupuncture.
Oh, okay. Now, that's very interesting because I didn't realize that. So if you want to be an acupuncturist in China,
yes,
you have to study medicine first.
And then acupuncture.
And then acupuncture. Okay, that is really interesting. So I guess you know how to treat the body.
Sure.
With or without acupuncture. You know, like where the body might be more sensitive or where it might need extra treatment.
Yeah, it is like acupressure points. It is very well known. It is used by martial artists.
Yeah.
Like they call it pain points. Okay.
Pain points.
Pain points. That is what they are trying to strike, so to win the fight. Okay.
Sure.
So all of these things have been in us forever.
Yeah.
And just that we are rediscovering all of this knowledge from our ancestors.
Yeah.
Okay.
So, as you say, it's a family tradition as well, because all your family are acupuncturists.
Yes.
And your family have clinics in Madrid,
In New York and in China.
and you've worked in all of them.
In all of them, yes.
Fantastic. So now you have opened your own clinic in the Puerto de Mazarrón,
Yes.
and which is just down the road, literally.
Yes. It's just in front of the health center. I find this place I find Puerto Mazarrón very beautiful. And just after coming here once for a visit, I just decided I wanted to live here and to stay here.
Yeah, no, it's fantastic. Now, let's get to the nitty-gritty. As I said to you, most people, well, myself, I'll say, for example, myself, I think that acupuncture is about putting needles in your body, and it will help you with any ailments that you may have. But I know there's a lot more to it than just that. So first of all, tell us, what is acupuncture?
Okay, so acupuncture is a medical practice okay, using hair-thin needles to stimulate acupressure points, okay. All of this works in the Qi system, okay. This Qi, which is not understood for many people, okay. Qi, essentially, it is just water and heat. It's steam.
Okay.
As we say it. All of this steam, where does it come from? Okay, so our body is made out of 60% water, which everyone knows. Okay, and we have body heat. Okay, when you mix these two factors, it produces vapor or steam in our bodies.
Okay.
We can see it in cold weather conditions. If we exhale, we see actually this cloud of fog. Or after exercise in a bright day indoors, you will see actually steam coming out of people.
Yeah.
Okay. So our body has a system of regulating the steam, the humidity inside of us. And this system, only acupuncture can regulate it to treat health conditions.
Okay.
Okay, so this has been done for thousands of years, as we all know it. And this Qi, some people call it chakra, some people call it aura, right? Yes, so actually all civilizations have been talking about this and writing books and studying it for as long as we know it.
Yeah.
But just that in this modern era, there's too much information that everyone knows a little bit of everything, but not the full. Cannot see the full picture.
No, absolutely. Because a lot of people nowadays just rush to the doctor to get tablets, I think.
Yes.
And the tablets might mask the symptoms,
Yes.
but they never really cure you, because most people, once they start taking the tablets, they're on them for the rest of their life, aren't they?
Yes.
And with alternative or complementary therapy, that aims to get at the root of the problem.
Yes. We always try to aim for the root of the problems. We know that chemically treating the illnesses or diseases it's not gonna get you that far. If you don't treat the root of the problem, and all the pills are just it is very good, actually. All Western medicine, I really like it because it is effective.
Yeah.
It is really effective at the moment, but it doesn't get you that far.
No, absolutely. Because what you're saying with acupuncture is that it will go to the root of the problem. And would you say that it can cure a problem, or tell me?
Well, it really depends on the state of the patient. Okay, so if they are already on late stages, let's say like diabetes, when people have already lost sight and have many pains in the body, I've treated many of these patients. Okay, reducing the pain, but there are some things that cannot be treated. But also, there's a lot of patients who come to me who have to take 5 painkillers a day to make it, and after a treatment, they have lost 80% of the pain.
Wow! And then they can start gradually, under doctor's advice,
yes, and
come off the
keep with their lives.
Yeah, absolutely. Okay, so let's get on with some questions that obviously these are the questions that people most often ask you. So what can acupuncture do?
Well, acupuncture is pretty well known for its anti-inflammatory uses. Okay, so there are many uses. The most common that people can read about it is anti-inflammation, decrease or eliminating a chronic pain. Okay, it regulates blood circulation, liquid contention, and it improves the digestive system. Okay, it is also known for post-stroke treatment and partial paralysis.
Okay, so
Okay.
it can treat a lot of conditions.
Yes, and all of this I have seen it everything with my own eyes
Yeah.
of the process of patients getting better.
Okay, can you give us an example of somebody who had something and then you treated and saw they got better?
Well, there was in Madrid. I used to treat like 6 people every hour.
Oh, wow.
Okay, so there's every kind of illness that come to me, and to see if there's another way to improve.
Yeah.
Okay, so there is diabetes, people with stroke, hemiplegia, which is like half the body just stop working.
Wow.
It is
What is that? What's that called?
hemiplegia.
Hemiplegia.
I don't know if in English it's like this. Okay, but we have seen these people in the even in the streets that have like half their face paralyzed.
Yeah.
Okay, or half their body paralyzed after a stroke. Okay, so acupuncture is pretty effective. treating
Okay.
that, yes.
So it can help stroke patients.
Yes.
It can help people who've got diabetes, who've had blood problems.
Yes, tension problems.
So blood pressure.
Yes.
And it can help also like knee problems.
All pains.
All pains.
All pains. It can be treated with acupuncture,
Yeah.
and the decreasing the pain is one of the most important aspects that acupuncture can bring to patients.
So when we talk about conditions that it can treat, would you say it can treat almost all?
Not really.
Okay. Tell us what you think it's not good for.
Well, I cannot say what is not good for.
Okay.
I would say what is really good for, and well, it really depends on the stage of the patient and when they come to me.
Okay.
If someone has like a chronic migraine,
Mm-hmm.
okay, if they had it for 7 years or 10 years, then it will take more time.
Right.
Okay, but if they come like on the first year or quickly,
Yeah.
they can find a good acupuncturist. Then they could solve the problem easier.
Yeah,
faster.
and faster. That's what I
Yes.
was going to say, because I suppose when you've got a problem with your body and you've had it for a long, long time, then why is it that it takes so long to heal it from traditional medicine to acupuncture?
Oh, well, illnesses. Okay, if you had an illness for, let's say, all your life, or 10 years or 5 years, depending on the patient, it will take. There is no like straightforward like a surgery, like taking something off.
Out, yes,
out.
yeah.
Okay, we only like to do that in the if there's no any chance. Okay.
Sure.
Before of that, everything is treatable.
Yeah,
Okay, and it really depends on the patient.
sure.
Okay, everyone has different healing
Yes.
properties. Okay, and it takes a
Yeah.
while to see.
Yeah, I guess really, as you just say, everyone has different healing times, and if you've had an injury or an illness for a long, long time, it's going to take you equally as long.
Not that long, but
Okay.
after just a simple treatment. Well, not once,
Yeah.
but a few sessions. Okay, the patients they will give me the feedback
Yeah.
of how they have improved. Okay,
Yeah.
so there's people who lost pain in 2-3 sessions. Other people took them longer, but they gain something else. Okay, because once we regulate our body,
Yeah.
okay, everything starts changing and everything starts improving.
Right.
Even our state of mind. For people who meditate and people who really like the mind meditation and improving stuff. Okay, our body is connected to our mind, so it is all together. Our mind cannot be free if there's pain or bad things happening to our bodies.
Absolutely, absolutely. Yeah, no, 100%. You have to treat the whole of you, not just take a tablet and then that'll be fine.
Yes.
Because, I mean, I'm not saying all tablets, but a lot of tablets have side effects that go with them.
Course.
And at least what you're advocating and your treatment.
Yes. There's no chemicals in it. Okay, it's all. That's what Chinese traditional medicine is more. A physical medicine. Okay, so we use acupuncture, we use massages, we use. Well, there's also Chinese medicine, but that is for very serious problems. Okay, acupuncture works mostly for many illnesses, and it improves. There's always improvement.
Okay, good. Right, what we're going to do is we are going to play some music, and then I'm going to play some adverts. So we'll give Dr. Ali a little rest, and then we'll come back and we'll continue chatting. Welcome back. You're listening to Ruma Jordan on I Heard of Ruma, and my special guest today is Dr. Ali from Clinica Acuvip, and he has been talking to us about acupuncture, and it's a fascinating medicine, all natural, all pure, all out there to get to the root of your problem. So you're not having any medication that is going to mask effects. It's actually aiming to get to the root of any problems that you have. So welcome back, Dr. Ali.
Yes.
Tell us a little bit about your clinic, Clinica Acuvip.
Okay,
Yes.
so Clinica Acuvip started out as an initiative of doing my own clinic. Okay, I was working in Madrid in my family's clinic. We have plenty of, my family has different clinics over Spain. So then I went to Castilla-La Mancha, and then I came here to Puerto Mazarrón and decided I want to start my own thing. Okay, it started like this, and I want to settle here, how to say it, modern, traditional Chinese medicine clinic.
Yeah.
Okay, so it's just bringing ancient knowledge back to this era, and hopefully in the future, I will keep developing more treatments and providing other treatments apart of acupuncture, because Chinese traditional medicine has so much. I would like maybe in the future do teach classes in medical Tai Chi, which is very good for Parkinson disease patients.
Okay, yeah.
Okay, you can see it over in YouTube, in all the online. Okay,
So you can see how. Explain that again. That is Tai Chi, clinical Tai Chi?
Medical Tai Chi.
Medical Tai Chi.
It is Tai Chi, but aimed just to give a treatment for Parkinson's disease patients.
Fantastic.
To decrease their trembling.
Yeah.
And treatment like this, I would like to keep developing and provide it to this region.
Yeah, and what other treatments?
Well, there's also in the future I would like to do like memory loss treatment. Okay, it is not that you will get better memory, but you can contain it while you are aging.
Okay, that's interesting. That's interesting. So at the moment in your clinic, is it just acupuncture?
At the moment, is acupuncture and massage. Okay, the massage is also a therapeutic massage. It's different to the normal massages. It's not for pleasure. It hurts a little bit, okay, but it's more for for medical purposes.
Yeah, it's to treat the
Yes.
problem.
Yes.
Okay, so can you give us some references so if people wanted to know more about acupuncture?
Yes, I think a simple read will be to go into the NHS, the UK, okay, and first just search for acupuncture. There's a very well explanation, okay, by the NHS of
Yeah.
how acupuncture is, what it can treat, how is the process,
Sure.
and all of this. There's many acupuncturists in the UK also.
Yeah.
Okay, and it's a very good, quick, good read.
Yeah, yeah,
Okay.
good.
Also, there's a lot of books about acupuncture. One of the first encounters of the Western world with acupuncture was when President Nixon, went the first time to China and saw how people were treated with acupuncture for surgeries.
Yeah.
Okay, using no anesthetics, just
Wow.
acupuncture and do open heart, open head surgeries.
Wow.
Okay, acupuncture has a very, very strong effect of anesthesia.
Okay. That's really interesting. So what you're saying is is that actually done nowadays, that people can have surgery without anesthetic but just using acupuncture?
In China, there is.
Yeah.
In China, where there's acupuncture, Chinese medicine is very well established. There is
Sure.
the Chinese traditional medicine hospital and the normal Western hospital. Okay?
Yeah.
So in those hospitals, they can do very incredible things.
Wow, that is just mind blowing. Okay, so we were talking in the break because a lot of people, that live in this area, there are the elderly generation, a lot of them. And as you were saying to me, that usually people, when they come and see you and they're a little bit older, they have more than one issue. So can you give us an example of what you treated and how you treated it?
Well, I've treated many people, and everyone has a different illness. Okay, but the common thing is that at that age, okay, patients have many things related to. It started all with one thing, but
Sure.
it started to expand. There's pains, let's say in the elbow, everywhere.
Yeah.
Okay, so the good thing about acupuncture is that we don't treat just your disease. We try to treat everything at the same time as we can.
Okay.
Okay.
So could somebody, for example, come and see you and say, "Oh, I've got a problem with my knee,"
Yes.
but then you find out that it's more than their knee?
Yes, of course. All illnesses, they have, let's say, as an example, like diabetes patients, over time, they will lose their sight.
Yeah.
Okay. Not everyone,
No.
but they will.
A lot of people with
people,
diabetes, have.
lose their sight slowly, and start to get pains all over the body. Their body starts to change. Okay, and for these patients, I've treated in Madrid. What we do after acupuncture, it really helps them to control all this pain.
Oh, wow.
Okay? And they can feel it at the moment.
Yeah. So when somebody comes to you for a treatment, say for their knee, do you put the needles just on the knee?
No.
Ah, okay.
The proper acupuncture is not. Well, there's a lot of people who haven't studied enough, who haven't practiced professionally. Okay, they actually will. You'll have like a pain in your knee. They will just put some needles there and see if it works. For professionals, what we do is that we try to regulate the whole internal system, okay, because we know that that pain is not, it didn't come just from that. You know, it's like even for diabetes patients, okay, those pains comes from the illness of diabetes. It's not from the leg or from something else. So what we try is to, at the same time, regulate all we can in the body and take all the pain we can.
Yeah, yeah.
So
You said something interesting a while ago about digestion.
yes.
Tell me how acupuncture helps digestion.
Digestion is well. So we have all this system to eat, digest, okay, and there are some points that are very well known. Well, there's one called Zusanli, which is here
Just under the knee.
under the knee. Okay,
Yeah.
these points are very well known to treat a stomach ache.
Oh.
Okay, and some stomach aches, they bring that is what we were talking. Some people who have like a chronic stomach ache, it will develop into a headache.
Yeah.
And they will have also the headache for a long time.
Yeah.
Okay, so with acupuncture, what we treat is at the same time the stomach ache and at the same time the headache.
Yeah. Oh, okay. No, I'm really fascinated by it because, you know,
Yeah.
I like anything alternative, to be honest with you. So this fascinates me. I don't really like taking tablets or anything like that. So I would rather go and see somebody like yourself than go and see a doctor.
Yes.
Obviously, everyone is different, and it's what suits everyone else. Okay, so let's tell people how they can find you and what times your surgery is open. Your clinic, is open. So,
well, my clinic is open from 9 a.m. to 8 p.m.
yeah,
Okay, I work from Monday to Friday,
yeah.
and I am in front of the
Medical center.
medical center. Just next to it, you can see it in the park.
Yeah.
Okay.
Oh, yeah, the children's playground and the Petanka area. You're
Right
just
there.
there,
Right there.
aren't you? Yes, I know where you are. Now, also, you are closed between 2 and 5 every day.
Yes.
So it is 9 to 8, but 2 to 5 you're closed, and it's Monday to Friday.
Yes.
And your phone number, so if anybody wants to book an appointment with you and they're listening now, everyone go and get a piece of paper and a pen to take down this phone number.
Okay, at the moment, it is 666-388-020.
Fantastic. And also, Dr. Ali has an advert on Costa Calida International Radio, so you will hear his contact details on the advert as well. Okay. Have we covered everything, or is there anything else that you would like to add?
Well, for the moment, I think I gave a pretty simple explanation. I hopefully I could come back here someday and just talk a little bit more.
Absolutely. I would love that. In fact, I am going to book myself an appointment with you, and then I can tell the listeners how you've helped me.
Okay.
Because as I was saying to you earlier, I do have problems with my knee. And so I would like to get that sorted, because after about 2 or 3 kilometres of walking, I have to stop and stretch it out. And I would like to be able to just keep on walking 5, 10 kilometres, whatever I want. So that would be fantastic. Dr. Ali, thank you so much for coming in the studio. It's been brilliant having you in here. And good luck with your clinic.
Thank you very much, Ruma, and thank you to all the listeners. It is my pleasure to be here today, and hopefully I can talk to you again.
Yes, perfect.